Hello, Dr. Stacy Francis here. We're going to talk about lab work and the secrets they reveal. When we look at labs as a functional medicine practitioner, we're looking deeper. When you go to the doctor and you say, I'm really tired, and they run labs and they say, you are perfectly normal, everything's fine, you're so healthy, and you still go home feeling really tired and fatigued, brain fog, can't lose weight, all the things, that's when functional medicine comes in. We actually dig deeper and we look at the why. So instead of just putting Band-Aid on a cut, what we do is find out why you got cut, right? And we remove whatever is causing that. So here's a great picture of how functional medicine works. So around the tree, you'll see, around the green, you'll see all the things that people come into their doctor for, because they're gaining weight, because they have asthma, allergies, they feel like their thyroid's not functioning well, they have anxiety, rashes, reflux, memory problems, arthritis, lots of different problems, right? If you look deeper to the roots, then you're going to find out why those problems are happening. Functional medicine digs deeper. And one of the ways we do that is we really do a much more thorough history. We ask more questions. The second way we do it is, the lab tests that your doctor does oftentimes are only the ones that are covered by insurance. Let's take thyroid, for example. If you look at a list of thyroid symptoms, hypothyroid symptoms specifically, you'll see that it's fatigue and weight gain and dry hands and dry skin and cold hands and cold feet. And if you have those symptoms, you might go to your doctor and say, I think I might have a thyroid problem. And that doctor will say, okay, maybe you do. So let's run some tests. But the only test they'll run is a TSH, which is a thyroid stimulating hormone test, with a reflux to T4, which means that only if TSH is out of range will they do a T4 test. But those are the only two tests they'll do. They won't dig any deeper. But there is a really long pathway with thyroid function, and a lot of things can go wrong. We look deeper. So I will do tests that doctors typically won't do to find out if you really do have a thyroid problem. Oftentimes when we look at that, we'll see that your immune system may be attacking your thyroid. Your thyroid is functioning fine, except it's inflamed and not doing what it needs to do because it's inflamed. It has the ability to function, but it's not functioning at the level it needs to because something is attacking it, right? So when we're looking at the causes, we're looking at nutritional deficiencies first and foremost, which is why the supercharged method is full of great nutrients and whole foods, and it's fixing things that you didn't even realize were a problem. It's addressing stress. It's looking at genetics. It's looking at poor digestion or lack of sleep and trauma and medications you might be on and exposure to toxins and infections. And all this, if it does not get resolved, it can turn into bigger things. And my whole mission is to prevent heart disease and diabetes in my community, amongst my patients and my, extended community, because that's something that my parents both had and something is preventable. But even cancer is something that can turn up if these things are not addressed. So that's why functional medicine is so important, why I'm so passionate about it. It's because there's so much we can do, and people can feel so much better if they would just find out what's going on. Why am I so tired, foggy-brained, unfocused, weak, unable to lose weight, anxious, depressed, achy? The first thing we do is we do a really thorough history. We ask, when did it start? What happened or changed around that time period, either physically or emotionally? What did you do about it? What helped? What didn't help? We dive deep into these questions to really find out if we can get some answers. And we never want to recreate the wheel. So if you've tried something very thoroughly, we will have you not do that again. But if you did something that really helped your symptoms and it helped significantly, we're going to ask, why are you not doing that again, right? So when we look at labs, these are the labs I most typically do, not on everyone, but depending on the situation. But the first one is a biocomprehensive, and it is a blood and urine test that is really comprehensive in regard to finding out just an overview of how things are going. And when your doctor does these tests, they will do some of them. They'll do a lipid panel, they'll do glucose, they'll do liver evaluation, things like that. We include all the things your doctor will do, plus we look deeper at organ systems, gland systems, blood sugar balance, anemias, thyroid, and inflammatory markers that don't always get done. In fact, they rarely get done, but they should get done every time you have a blood draw, which most people it's once a year. If you're struggling, we might look at it every 3 to 6 months to make sure we're moving in the right direction and we're doing what is serving you. Plus, of course, your symptoms will be resolving if we're on the right path. A Nutri-Eval is a comprehensive functional and nutritional assessment. And what it does is it actually looks at your nutrient status. Do you have enough vitamin C, vitamin A, B complex, things like that? It looks at toxicity. So it looks at chemical toxicity and heavy metal toxicity. It looks at how you metabolize energy. And we're going to talk about that in just a minute. Another test we do is a GI effects. It is a comprehensive stool analysis that is a really deep dive into the digestive system. It will tell us if you're digesting your proteins, your carbohydrates, your fats. It will look if there's inflammation in the GI system. It will look for microbes or bacteria or viruses in your GI system. It looks at parasites. So we can really see what's going on if you have any gastrointestinal symptoms. And the last test that I most commonly do is a cardiovascular health test. And it really looks at not just LDLs and HDLs, but it looks at particle size. And we look really deep to see what your risk of heart disease would be. So those are the tests that I do most commonly. There are a few off tests that I do. Some people ask me, do you do allergy testing? Allergy testing, I rarely do via blood work because there's a lot of false positives and false negatives. I do muscle testing to screen, and elimination diet is the very best way to evaluate whether or not you have food sensitivities. So here are the tests that I most commonly do when I'm looking for more specific things. And this is what I recommend you look for in your blood work. This is what you can request from your doctor because they're going to do their own overall lab work that they always do every year. But you can make sure they're doing these specialized tests to, for instance, evaluate blood sugar. You're going to have a fasting blood sugar. Make sure it's 12 hours fasting, but you have a lot of water because you do not want to be dehydrated because that will skew the results. So you're looking at glucose, which is typically done, but insulin and hemoglobin A1C is not always done, and you want to include those. Insulin can show up as a problem before glucose does. And hemoglobin A1C is an overview of the last 3 months of your blood sugar. Another one that shows up for blood sugar is if it's high triglycerides. We know that might be a blood sugar problem. Anemias. If you are lacking in B vitamins or iron, you might have an anemia. And we look not just at iron, but at ferritin, which is stored iron. It's what you actually use to make your brain function. It's so important. If you're fatigued and your doctor says your iron's fine, make sure you're testing your ferritin. And there's MCV, MCH, TIBC, hemoglobin, hematocrit, and a B12, which is methylmalonic acid. We look at all these to evaluate how you are transporting oxygen for energy. Now we get to thyroid. Thyroid includes TSH, T4, It includes free T4, free T3, which actually I see is missing on this chart. It includes reverse T3, thyroid peroxidase antibodies, and thyroglobulin antibodies. Now, when we make thyroid hormone, it goes from being stimulated from glands in your brain to stimulating your thyroid to produce thyroid hormones that will travel in your bloodstream to get to its target organs so that you have energy, you can lose weight. It's like your thermostat. And the antibodies at the bottom, those are specifically to identify if your immune system is attacking your thyroid. So that's why those are so important. And the inflammatory markers. CRP is C-reactive protein. That is usually we do a high sensitivity CRP. So if you stub your toe, it will show up. But if you go in without any pain and that is still high, then it can be an indicator of other kinds of inflammation that's going on in your body that you might not even be aware of. Fibrinogen, sed rate, homocysteine are all inflammatory markers. And vitamin D is so important to know what it is that I put that in there too, because you should know what your vitamin D level is every time. The effects of high blood sugar. When we have a high carbohydrate diet, then it will have a rush of blood sugar that comes into the system, and that will surround the cells in the bloodstream. And when that happens, the whole purpose is to get the glucose or the blood sugar into the cells so you have energy and you're no longer hungry. But you can't just get the glucose into the cell. Insulin has to be brought in from the pancreas and land on the receptor sites on the outside of the cell in order for the cell to open up for glucose to come in. If that doesn't happen, then you will have high blood sugar because the glucose will surround the cell and not be able to get inside. And you'll have insulin floating around because it's trying to bind and it's not able to. If insulin tries to bind and is not able to, that means it's resistant to insulin. Your cells are resistant to insulin, and that is called insulin resistance. And when we have a lot of insulin in our system, then it is a fat storage hormone. So we're going to store a lot of fat because of high insulin. This all leads to being tired, hungry, loss of focus. It just makes you feel bad, which is a lot of reasons why people come to see me. Anemias, we started to talk about. Remember, it's from not enough oxygen and it's from low iron or B vitamins. Symptoms of anemia would be fatigue, feeling of unwellness, heart palpitations, hair loss, weakness, headaches, pounding in your ears, brittle nails, pale skin, dizziness, and even tingling in your body. You just feel tingling. You might feel tingling in your hands, in your feet, in your brain. It can be a B vitamin deficiency. When we talk about energy metabolism, I wanted to show you this very complicated picture. Energy metabolism is simply, at the top, you have food. You have your fats, carbohydrates, and proteins, your macronutrients. When they break down, they break into different components needed for energy production. And it goes into this cycle called the citric acid cycle or the Krebs cycle. And that turns into the electron transport chain, which actually is what creates your energy for your body to function. If we look a little closer to just the citric acid cycle, you'll see that on the inside, it's all the nutrients you need for this to work and to function. Oftentimes, you'll see in many places, iron or Fe is needed to function. So you need iron for this to happen. You'll see B vitamins are needed. We need all those B vitamins for it to function, to have energy. Also, GSH is glutathione. That is your master antioxidant. And you'll see other minerals like magnesium and manganese. So eating foods rich in iron and B vitamins is really important to make sure that you have enough of these nutrients to get that cycle moving and to have the energy you need. The thyroid gland is your thermostat, and it governs your metabolism. Raise your hand if you have a family member with thyroid issues. It typically does run in the family. There's a genetic component to it. And so if someone in your family has low thyroid or has been on thyroid medication, that is something to look at in you and your children. Symptoms of low functioning thyroid would include fatigue, brain fog, dry skin and hair, weight gain, especially around the middle, cold intolerance, like cold hands and cold feet, but even if you're always the coldest person in the room, digestive issues, especially constipation, and difficulty swallowing. Because when the thyroid gland swells, it can push up against your throat and you might have difficulty swallowing because of it. Symptoms of an overly high functioning thyroid can be just as troublesome. It can cause anxiety, feeling of overheated, hair loss, weight loss, shaking or tremors, and sweating. Eating foods to support thyroid function and remove food that don't. One of the foods we remove is gluten because of something called molecular mimicry. The molecular makeup of your thyroid gland looks very similar to the molecular makeup of gluten. And when your immune system has already attacked gluten as something troublesome, it can mistakenly look at your thyroid gland and say, that looks a lot like gluten, and start attacking that. And that is why we look at those antibodies to see if your immune system is attacking your thyroid, causing dysfunction. When this happens, you will have both hypo and hyper thyroid function. So you'll have all the overactive thyroid function symptoms, not all of them, but some of those, and some of the low functioning thyroid symptoms. And so it will go back and forth, and it can be very confusing because you can say, oh, well, I have symptoms in both those categories. That's when we look at the autoimmunity, if there's an immune system problem. And what are we going to do for all these things? We're going to eat to balance our blood sugar. We're going to include iron-rich and B vitamin-rich foods to correct anemias. We're going to remove foods that impair thyroid function, like gluten and sometimes even grains, and add iodine, selenium, and zinc-rich foods. Here's a list of iron-rich foods and B vitamin-rich foods. Here's foods to support thyroid function. And enjoy variety in your life. So make sure you include spices such as garlic, ginger, chili, herbs such as dill, thyme, lemongrass. There's so many herbs and spices to add and make your food just amazingly delicious. And there's, of course, great sauces. And the companies I really love that have really clean sauces are Primal Kitchen, Thrive Market, and Tessemae. If you do not change direction, you might end up where you're heading, Lao Tzu. And that is very common. If people come to see me and they are on a certain path, I always ask them, how is it working for you? Because if it's not working, we're going to change paths. Hope that was helpful. Have a great day.